Clinical rotation in psychiatry for ninth semester students of the Faculty of Medicine. The psychiatry clinical rotation in the ninth semester aims to train medical students in understanding, diagnosing, and managing various mental and emotional disorders. This rotation emphasizes patient care at different stages, including initial evaluation, therapeutic management, and rehabilitation. Additionally, students are introduced to a biopsychosocial approach to provide holistic care. 1. Objectives of the psychiatry rotation. Clinical competencies. Conduct systematic psychiatric interviews to evaluate patients' mental conditions. Identify various mental disorders according to diagnostic criteria, e.g., DSM-5 or ICD-11. Develop a therapeutic plan, including pharmacotherapy, psychotherapy, and other non-pharmacological approaches. Procedural competencies. Perform mental status examinations, MSE. Manage crisis situations, such as patients at risk of suicide or violence. Provide basic counseling to patients and families. Communication and collaboration. Communicate effectively with patients experiencing mental health disorders, including those who are non-cooperative. Collaborate with multidisciplinary teams, such as psychologists, psychiatric nurses, social workers, and counselors. 2. Learning structure and daily activities. The psychiatry clinical rotation involves learning at various mental health facilities, such as psychiatric wards, outpatient psychiatric clinics, and crisis units. A. Psychiatric outpatient clinics activities. Conduct interviews and evaluate outpatients with various mental disorders, such as depression, anxiety disorders, or schizophrenia. Discuss cases with psychiatrists. Provide counseling to patients and families. Objective: train skills in psychiatric history taking and diagnostic formulation. B. Psychiatric wards activities. Observe and assist in managing inpatients with severe mental disorders such as bipolar mania, psychosis, or substance use disorders. Monitor patient progress through daily observations. Objective: teach students intensive management of severe mental health conditions. C. Psychiatric emergency unit activities. Handle patients with psychiatric emergencies, such as acute agitation, suicide risk, or suicide attempts. Provide de-escalation therapy through communication and pharmacotherapy when necessary. Objective: train students to manage psychiatric cases requiring immediate action. D. Psychiatric rehabilitation activities. Participate in rehabilitation programs for patients with chronic mental disorders. Assist in training patients in social skills and daily activities. Objective: understand the importance of rehabilitation in caring for patients with chronic mental health issues. 3. Diseases and conditions covered. A. Mood disorders, depression. Diagnosis based on DSM-5 criteria, such as persistent low mood, loss of interest, and physical symptoms. Treatment with pharmacological therapies, antidepressants, and psychotherapy, such as cognitive behavioral therapy, CBT. Bipolar disorder. Management of manic phases with mood stabilizers, e.g., lithium, and antipsychotics. Treatment of depressive episodes with combined therapies. B. Psychotic disorders, schizophrenia. Diagnosis through symptoms such as hallucinations, delusions, and thought disturbances. Treatment with first or second generation antipsychotics. Acute psychosis. Initial stabilization with injectable antipsychotics when necessary. Evaluation of psychosis causes, such as substance use or medical conditions. C. Anxiety disorders, generalized anxiety disorder. Pharmacotherapy with SSRIs or benzodiazepines. Long-term management with CBT. Panic disorder. Acute panic attack management with breathing techniques and medication. Psychotherapy to address anticipatory anxiety. D. Stress disorders, PTSD. Psychological trauma treatment with exposure therapy or EMDR. Pharmacotherapy for insomnia or anxiety. Adjustment disorder. Supportive counseling and therapy to aid patient adaptation. E. Substance use disorders, alcohol dependence. Withdrawal management with benzodiazepines. Long-term rehabilitation programs. Narcotic dependence. Detoxification therapy and psychosocial support. F. Neurocognitive disorders, dementia. Diagnosis through history taking and cognitive tests like MMSE. Management with medications like donepezil to slow progression. Delirium. Treatment of underlying medical causes. Environmental support and pharmacotherapy for agitation if necessary. 4. Mastery of clinical procedures, basic procedures. Conduct psychiatric interviews to evaluate mental and emotional symptoms. Perform mental status examinations, MSE. Assess suicide or violence risk. Advanced procedures, under supervision. Apply the escalation techniques for agitated patients. Interpret psychometric results such as MMPI or WAIS tests. Manage pharmacological treatments for acute conditions, such as agitation or severe depression. 5. Learning methods. A. Bedside teaching. Observe and practice psychiatric interviews under psychiatrist supervision. B. Case discussions. Analyze cases, such as severe depression or psychosis, to understand pathophysiology and therapy planning. C. Clinical simulations. Practice psychiatric interviews with simulated patients. D. Observation and participation. Observe and participate in psychotherapy sessions or crisis interventions. 6. Assessment. A. Daily evaluations. Assess skills in interviewing, diagnosis, and therapy management. B. Mini CEX. Evaluate procedural skills, such as psychiatric interviews or risk assessments for suicide. C. OSCE. Simulation-based examinations for psychiatric scenarios. D. Logbook. Document clinical experiences during the rotation. 7. Challenges and opportunities. Challenges. Building therapeutic relationships with incooperative patients. Complex diagnoses in mental disorders with physical comorbidities. Opportunities. Unique experience in understanding patients' mental and emotional aspects. Development of advanced communication skills. Conclusion. The psychiatry clinical rotation trains students to address challenges in managing patients with mental health disorders. This experience is essential for developing a holistic understanding of human health, encompassing physical, mental, and social aspects. Through case-based learning and supervision, students are prepared to provide comprehensive care to patients in the future.